Welcome back, everybody, to Leading Experts. I'm your host, Grayson Foster. If you're just tuning into the show today, my guest is Dr. Elon Chang. She is a general and cosmetic dentist. She's also a member of the Academy of General Dentistry, the American Academy of Cosmetic Dentistry, and the Doctors of Conscious Sedation. And she's also certified in dentistry for diabetics. And we've been discussing certainly many aspects of general and cosmetic dentistry. Dr. Chang, let's start with dental technologies. They've certainly come a long way since I was a kid.
Absolutely.
And seeing my dentist. So what technologies are you using in your practice?
Okay. The first thing I have to say is we'll call the dental laser cavity scanner.
Okay.
And we use it for almost a couple years now. And it's a laser light that it detects cavity early.
Okay.
And a lot of times we use a conventional way using a probe detecting it, and sometimes a lot of time we miss almost like 50% of them. And this laser light is just very, very, very accurate. It's just amazingly accurate. So it allows us to be able to detect cavity early and treat them early.
Okay. And also you have you do a lot of digital x-rays, right?
Right. We have two types of digital x-rays. One is called a panoramic x-rays. Basically it's taking x-rays very, very simple. You just stand there, this machine will go around your head, and so there's no more gagging and things like that. Patients just love it. And also it cuts down the radiation by 90%.
You also use digital cameras and
intraoral camera. There's a lot of, because of the digital era here, and we are able to take any kind of pictures inside your mouth, and we'll be able to show it on the screen. Patient understand exactly what their dental conditions are, and we'll be able to present treatments, and they understand exactly what's going on.
I want to go back to the cavity issue for a moment. You can get a cavity at any age, right?
Yes, definitely.
Yeah, so it doesn't matter how old you are.
Right, correct.
Okay, good. That's why you need to see your dentist. I know something you also check your patients for each and every time is certainly oral cancer. How critical is that?
Oh, it's very critical. What happens in the past 40 years, the oral cancer rate has not changed at all. So we have a special test called the oral cancer screening test, and it's just like women go through pap smear. It's the same principle. Right. And this allows us to be able to detect the oral cancer in the first and second stage. So hopefully by doing this, we can improve on our statistics on oral cancer.
In your 27 years of practice, have you come across some patients that have had?
Oh, definitely. Yeah, definitely.
That's scary. I know something else you do is you help your patients get rid of their mouth full of metal.
Yes. The mercury filling has been around for hundreds of years, and what happens is they create a lot of cracks and leakage inside the silver filling. So what we do is we place a lot of silver fillings, and by doing that, we create really very, very pretty teeth for them. They last for a longer period of time. Also, they're bonded, so there's no chemical contamination and things like that, so it's very healthy for them.
Let's talk about the baby boomers that you deal with, certainly in your patient population. Are they sort of a special group that have different issues than maybe your younger patients?
Mostly, I think the tooth loss, because back old days you don't have the type of dental care, that type of dental technology is available. So gum disease is also a concern also.
Right. Because once you get gum disease, you're at risk of losing a tooth.
Right.
Okay. I want to talk about whitening now as well, because that's a huge issue.
Right.
What kinds of things are you doing in your practice for whitening?
We have two types of whitening. One is we can do it in our office, and what it involves is a very, very high strength of bleaching gel. What we do apply over your teeth, and we shine a light over that area. You can get immediate results almost within an hour. Okay, there's another type of bleaching we call take-home bleaching. Okay, what we do is we take impression of your teeth, and we provide with special trays, custom trays, and also we provide you with the material. You just basically do it at home yourself. And that will probably get the really good results within 5 to 7 days.
Once you have your teeth professionally whitened, do you have to be more careful over the next couple of days in terms of what you're eating and drinking?
You might feel a little bit sensitivity. Usually the fluoride can take care of that problem for you. It's only transient during the time you're having that done.
Okay. For your younger patients, do you do a lot of sealants?
Yes, we do.
Yeah.
Sealant is a really good thing for kids, especially because during that age, especially between say 6 to 11 or 12, they don't have that dexterity to take care of their teeth. Sealant is basically going over the grooves. That's the area that where cavity first starts.
Right.
And so, so this allows them not getting cavity during that stage. It really helps with the cavity control.
Okay. Since we're talking about the younger patient population, certainly a current trend is tongue piercing.
Oh, yes.
And that just destroys your teeth.
Yes.
So share with the viewers
Okay.
how bad that is.
I have seen a lot of younger people, they have that. Then what happens is, because the tongue's in the way, a lot of times when they eat, they're not paying attention, so a lot of times they end up cracking their teeth. And so, especially the metal kind, okay, the better one would be the plastic one, but in the end, they still has the same problem. So a lot of times they can get infection around their tongues, and sometimes it's just very nasty sometimes.
And
so the best thing is just not to do it.
Yeah, just don't do it.
Yeah.
And obviously, if they lose a teeth, they're going to have an implant.
Well, yeah, right. You need a crown. So it depends on how it's fractured. You know,
Yeah.
if it's fractured well enough, you can take care with a crown. But it's really broken down to the bone level and things like that, then you may end up losing the tooth.
Right. So they're just setting themselves up for more grief down the road.
Right.
We just have a few moments left in the show. If someone's watching today and they haven't been to the dentist for a long time, what would you say to that person?
Okay. I think the thought has changed now in the past 10 years. Before, people don't take their teeth very seriously. But in the past, I would say 10 years, there's a lot of research that gone on, not only that affects your dental health and also affects your physical health also. So, like we have talked about before, increases your heart attack, and increases, you know, it's harder for you to control your sugar level.
Right.
And it's also connected with pancreatic cancer. So there's a lot of things happening. It's a part of your body, so it's very, very important for you to see a dentist on a regular basis.
That's one thing we didn't touch on briefly just before we go, is the fact that flossing may help prevent heart disease. There was a study out, right?
Right.
Yeah.
Flossing, basically, you get rid of the plaque around your gums. Okay, when you have plaque, it causes inflammation of your body. When it causes inflammation of your body, that goes right into your bloodstream, and that causes all these things we talk about: cardiovascular diseases, you know, diabetes, cholesterol, and things like that.
Right. Once you've had a patient who's had gum disease, are you able to turn it around for them?
Gum disease never goes away. You can only get to, you know, get to a certain level. So you want to be able to maintain at that level so it doesn't progress any worse.
As a friend of mine who had periodontal disease would say, plaque never sleeps.
Right. Yeah, it forms almost like 20 minutes right after you eat and just right after you brush. So it's there constantly.
All right. I need to go see my dentist.
Yes,
Dr. Chang, thank you so much for being here.
Thank you very much.
Appreciate it. Thanks for watching this edition of Leading Experts, everybody. We'll see you next time.